my team. Today I am going to discuss about glaucoma, which is often referred as a silent thief of sight. If you see this picture, glaucoma is a disease that damages the eye's optic nerve. It usually happens when fluid buildup in the front of the eye. That extra fluid increases the pressure in the eye, damaging the optic nerve. Now we will see the main cause of glaucoma. Our eye constantly make aqueous humor. As new aqueous humor flows into the eye, the same amount should drain out. The fluid drain out through an area called trabecular meshwork. This process keeps the pressure in the eye, called intraocular pressure or IOP, stable. But if trabecular meshwork is not working properly, fluid builds up. Pressure inside the eye rises, damaging the optic nerve. The optic nerve is made up of more than 1 million tiny nerves fiber. It is like an electric cable made up of many small wires. As these nerve fibers die, patient will develop blind spot in the vision. Patient may not notice this blind spot until most of the optic nerve fiber have died. If all of the fiber dies, patient will become blind. Now, I shall discuss about the type of glaucoma. The first one is open angle glaucoma. This is the most common type of glaucoma. It happens gradually, where the eye does not drain fluid as well as it should, like a clogged drain. As a result, eye pressure builds and start to damage the optic nerve. This type of glaucoma is painless and cause no vision changes at first. Do you know what is trabecular meshwork? It is an area of tissue in the eye located around the base of the cornea near the ciliary body and is responsible for draining the aqueous humor from the eye via the anterior chamber. The chamber on the front of the eye covered by the cornea. The second type is angle closure glaucoma, which is also called close angle glaucoma or narrow angle glaucoma.
This type happens when someone's iris is very close to the drainage angle in their eye. The iris can end up blocking the drainage angle.
Patient can think of it like a piece of paper sliding over a sink drain. When the drainage angle gets completely blocked, the eye pressure rises very quickly. This is called an acute attack. It is a true eye emergency. Now in this section, we shall discuss about symptoms of glaucoma. With open-angle glaucoma, there are no warning signs or obvious symptoms in the early stages. As the disease progresses, blind spots develop in the peripheral side vision. People at risk of angle closure glaucoma usually shows no symptoms before an attack. Some early symptoms of an attack may include blurred vision, hollows, mild headache or eye pain. People with these symptoms should be checked by their ophthalmologist as soon as possible. Now we shall proceed further and talk about who is at risk for glaucoma. Some people have a higher than a normal risk of getting glaucoma. This includes people who are over age 40, have family members with glaucoma, have high eye pressure, are far-sighted or nearsighted, have had an eye injury, use long-term steroid medication, have thinning of the optic nerve, have diabetes, migraine, high blood pressure, poor blood circulation or other health problem affecting the whole body.